How many treatments do I need is likely one of the questions you may have. This is also a question that I get asked on a day-to-day basis. It's a challenging question to answer because it all depends on the severity of the jowliness in your face. It's subjected to multiple different factors, and it is important that I see you in person in order to give you a more accurate assessment of the number of procedures you might need. However, the majority of the patients who have had the FirmaLift before, they are very happy with the results even after just one treatment. Occasionally, some of our patients require 2 treatments, and the results can easily last about 2 years. And then what we advise our patients do is that every 18 months to 2 years, perhaps consider having one treatment done just to maintain the result. When it comes to assessing the number of procedures you might potentially require to get to the ideal result you're looking for, we look at a couple of things. And I have mentioned this very briefly in my previous video. It all depends whether you have lost volume in the middle part of your face. If you have lost some volume in the middle part of your face, it is likely that you will need a combined approach. That is, you will need my 3D Ultimate Liquid Facelift procedure, which includes or involves the injection of soft tissue filler into the cheek area to sculpt and contour the middle part of the face, and that itself will soften the appearance of the jowliness, and thereafter we assess how much loose skin that's left behind, and then we proceed with having the FirmaLift procedure. It also depends how much loose skin we are dealing with and the condition of the loose skin, and that's influenced by the aging process and your age as well. And not forgetting that we also need to consider your lifestyle, whether you spend a lot of time in the sun, you use a sunbed, whether you are a smoker, and whether you have a very high metabolism. But in general, what we advise our patients is that they consider having a minimum 1, perhaps 2, even better, procedures in the outset, and then have it repeated just once every 18 months to 2 years. But a more accurate assessment requires that I see you in person in order to be able to give you a more accurate assessment of the number of procedures you are going to need.